uh, look at one by one what these tests tell in detail. The most commonly used endogenous marker for assessing glomerular function is creatinine. They are telling that one thing that can assess glomerular function is a marker, endogenous marker called creatinine. The calculated creatinine clearance is used to provide an indicator of GFR. So basically they are telling us कि अगर creatinine clearance we are using, then that will indicate GFR. This process involves collecting urine over 24 hours or over another accurately time period of 5 to 8 hours, as 24-hour collections are unreliable. Basically this is talking about the specimen collection, and we here the specimen is urine. We can collect it at the time period of 5 to 8 hours. 24-hour collection is not reliable. Next, creatinine clearance should be corrected for body surface area. Improper or incomplete urine collection is a major issue affecting the accuracy of this test. Hence, accurately timed collection is essential. Here basically they are talking about creatinine clearance. It is given by some equation which is not covered here because that will be a lengthy topic. So here basically you can know that creatinine clearance need to be corrected for body surface area, and if the urine collection sample is improper or incomplete, then the accuracy of this test will be affected. Furthermore, due to tubular secretions, creatinine overestimates GFR by 10% to 20%. They are saying because of tubular secretion, creatinine always overestimates GFR by around 10% to 20%. So, this is basically the test for serum creatinine. So, how what is the use? How it is used, and how specimen and collected, and what all calculations need to be done. I have covered every point here. We move on to the next slide. Here I will cover the next test. Albuminuria refers to the abnormal presence of albumin in the urine. Here also we are talking about albumin. Albumin is a protein in nature, and it is present mostly in eggs and egg whites and all, and it is present in the body, and it got secreted out through urine. So for the test for albumin, we refer it as albuminuria, which means abnormal presence of albumin in the urine. The term microalbumin is now considered obsolete as there is no such biochemical. The condition is now referred to only as increased urine albumin. The term microalbumin is now obsolete. That means now it is not used, and there are no biochemicals present of that name. So the condition is referred to only increased urine albumin. Albuminuria is used as a marker to detect incipient nephropathy in diabetics. Diabetics are those persons who have diabetes. Nephropathy means pathy, study of nephrons, or anything related to nephrons. So how do we detect it? By the help of albuminuria. Albuminuria is an independent marker for cardiovascular disease at its connotes increased endothelial permeability, and it is also a marker for chronic renal impairment. Albuminuria is an independent marker for cardiovascular disease. That means cardiovascular disease is related to heart and blood vessels. It increased endothelial permeability, and also a marker for chronic renal impairment. Renal impairment means kidney impairment. Chronic means for a long time. Endothelial permeability is a high level term which is not needed here. Frank proteinuria is defined as greater than 300 mg per day of a protein. Normal urine protein is up to 150 mg per day. Approximately 30 to 40% albumin, 10 to 20% globulins, and 50% uromodulin, TAM, horsefowl protein. They are present. The presence of albuminuria on 2 occasions, excluding a urinary tract infection, indicates glomerular dysfunction. The presence of albuminuria for 3 or more months is indicative of CKD. CKD here is a chronic kidney disease, and albumin presence indicates glomerular dysfunction. So this is all about the test. Urine albumin may be measured in 24-hour urine collections or early morning or random specimens as an albumin creatinine ratio. So here the specimen collected is urine. So this test is known as albuminuria and proteinuria. Now we go to the next slide. Urine analysis involves evaluating urine characteristics to aid in disease diagnosis through physical observation, chemical and microscopic examination. Now we are talking about urine analysis. The physical inspection involves assessing color and clarity. Normal urine is straw colored, whereas dark urine may indicate dehydration. Red urine may indicate hematuria or porphyria, or could represent the dietary intake of foods such as beets. Cloudy urine may be observed in pyuria due to urinary tract infections. Specific gravity indicates renal concentrating ability, which can be measured using refractometry or chemically a urine dipstick. The physiological range for specific gravity is 1.003 to 1.030. Specific gravity is increased in concentrated urine and decreased in dilute urine. So this was the test for urine analysis. In short, I can say that urine analysis means evaluating urines, and what will it do? It aid in diagnosis of any disease. We do 3 types of observations, that is physical, chemical and microscopic. In physical observation, we assess color and clarity. For normal urine, that is straw colored. Darker urine may indicate dehydration. Dehydration means loss of water. Red urine may indicate hematuria. Hematuria means blood in urea, or porphyria, or could represent dietary intake of food such as beets. When we eat beets, it is red in color, so it may be possible the urine comes red. Cloudy urine may be observed in pyuria due to urinary tract infection. UTIs are biggest problems, and when a person has UTI, the urine is always cloudy. Specific gravity is something which can be defined as a specific force